So what we want to talk about today are a couple of bizarre cases that we've experienced in our plastic surgery career. We've all been doing a lot of surgery over these years, and of course we know that sometimes some things show up that are really kind of unusual and out of the ordinary. I can start with a case where I was called to the emergency room to see a gentleman who had desired breasts. Again, gentleman who had desired breasts, and he had injected himself with airplane modeling glue. So you can imagine the results that that created and the infection that ensued, and he was quite a difficult case to deal with. So does that bring up anything with you,
well,
Dustin?
Yeah, coincidentally that reminds me of a case of a woman who I saw who in Mexico had injected injectable silicone into her breast. Now she had a doctor in Mexico do this, and she'd had it many years ago. It resulted in her breasts just being hard as a rock, both sides. And we ended up having to do mastectomy on her and breast reconstruction.
And I think that really highlights some of the disastrous things that occur when patients will go out and they'll seek the care and the treatment from non-plastic surgeons or even sometimes non-physicians, and it really can create quite disastrous results, right, Dan?
That's true. I mean, I think it highlights the point. Not only have we seen bizarre cases and bizarre outcomes, but we've also seen patients make extremely bizarre decisions. Decisions about where to have surgery, what country to have surgery under, what kind of unsterile conditions just to save a couple $1,000s. Or even, as you both had mentioned, and I've seen a number of cases like that, both in my training and practice, of patients injecting industrial silicone and materials into their bodies with the expectation that it's not going to be problematic in the future, which is quite amazing.
That's a good point. I had a patient that I got called to see in the emergency room who had an infected saline implant that was deflated, and the implant had to come out, and she admitted that she's the one that deflated the implant because she was just tired of them, and so she had an infected, swollen red breast. And I did ask her, how did you do this? And she said, well, I just got a needle and syringe from the Tractor Supply Company and did it. And this is what she resulted a week in the hospital and surgery to get that implant out.
So I think the take-homes here are that we do see bizarre things happening in plastic surgery all the time. Some of them are creations of patients themselves. Sometimes they're creations of others that they have solicited for their aid. So go see a board-certified plastic surgeon, see one of my great colleagues here, and you'll certainly be well cared for.